Welcome to Medicine, Motherhood, and Missions, the podcast where we dive deep into impactful and inspiring conversations with amazing professionals who've turned their challenges into stepping stones for success. I'm Johanna, your host, and each time we meet, we'll explore the stories and journeys of remarkable individuals who are PAs, doctors, professionals, mothers, and mission-driven changemakers, from the halls of the hospitals to the hearts of our homes, and into the communities we serve. Join us as we uncover the challenges, triumphs, and everything in between, and see life through each other's perspective. If you're seeking fulfillment in your career and life, I've got something special for you too. Download our free guide on how to be a fulfilled provider. It's packed with tips and insights to help you thrive while balancing the many hats you wear. And for all those parents out there dreaming big while raising little ones, check out Little Evie's Big Dreams children's book series, available now on Amazon. These heartwarming stories inspire kids to chase their own dreams, just like you're chasing yours. So grab your favorite cup of coffee or tea, settle in, and get ready for uplifting conversations that will leave you inspired and equipped to make a greater impact. Let's jump in. Hello, I'm so excited today because we have Venee Cunningham. She is a PA with a doctorate in medical science degree. She is a dynamic healthcare leader, entrepreneur, and expert multitasker who juggles marriage, motherhood, and a thriving career with equal parts strategy and caffeine. As a PA with a doctorate in medical science, Dr. Cunningham has dedicated her career to leading teams, improving healthcare operations, and mentoring the next generation of medical professionals. She's passionate about empowering women in medicine and proving that leadership doesn't mean choosing between career and family. It means mastering both. When she's not running healthcare initiatives, she's running a household because, let's be honest, being a wife and mom comes with its own executive level responsibilities. Today, she's here to share her insights on leadership in medicine, work-life integration, and why more women, especially wives and mothers, should confidently step into leadership roles. So get ready for a real, relatable, and inspiring conversation. Thank you so much, Venee. I love that intro. It says a lot, and especially a lot about the conversation we're going to have today. Thank you so much again for coming.
Thank you for having me. Thank you.
Yeah, and so the intro says a lot, but tell us a little bit about yourself and your journey to where you are today.
So this interview question has not been answered the same in my 17, 18 years of being a PA. I have a different response every single time. Yeah. But I've been a PA for 17 years now. I started out initially, I had a bachelor's in biology and couldn't decide if I wanted to go to be a physical therapist or become a pharmaceutical rep, which was booming back in 2004. And I ended up bumping into a PA in the operating room and literally said, this is what I want to do. I applied, went to PA school, finished PA school, thought that I was going to work in the operating room. And my last week in the OR surgical rotation, I fainted. So that was that. Man. And I ended up in an area that I said I would never work in because I thought to myself, I'm way too calm, cool, and collected to be in the ER. Like, it's just not for me.
Yeah.
And I ended up in the ER. So I've been in emergency medicine for the bulk of my career. Urgent care is mostly the other larger part of my career. First run-in leadership was in an urgent care position where I was the first PA that they hired. So I naturally graduated into this leadership role where I mentored incoming new graduates. I created programs for them, created escalation guidelines, did training, hiring, firing. I got a taste of leadership at a very early, stage in my career, and I loved it. I think it spoke to the answer I gave when I was about first, second grade. Whenever someone said, what do you want to be when you grow up? I'm like, I just want to wear sneakers and a suit and walk with a briefcase in the city. So to
That's awesome.
me,
Yeah.
that's just this leader slash boss
Hmm.
slash, in my head, that's what signified a woman of power. Like you wore
Yeah.
sneakers with a suit and you held a briefcase. I ended up in medicine, but for me, the fusion is working in leadership, working in operations, doing things
Hmm.
outside of the bedside care. So that's what my career 17 years later is starting to focus on
Hmm.
and merge into. It's moving a little bit more away from bedside and doing a
Yeah.
lot more where I feel like I'm just pouring into just the way operations are, how, other clinicians can, thrive in this
Hmm.
very difficult field of medicine. So that's where I am
Yeah.
now.
Yeah, that's so fascinating. I love that picture of a the future that you wanted for yourself as a second grader. I
Mhm.
think that's so like meaningful, because sometimes, a lot of little girls also just, have these visions of we ask them, what do you want to be in the future? And then that's why I love this podcast. I want it to be that, that vision, for young girls out there of what they can be one day, and I love that vision that you already had for yourself. It's
Yeah,
so powerful to have that for ourselves. Like, what do we want in the future as women? Because a lot of times in this day and age, there's so many other visions that are being poured into us
correct.
or shouted at us that this is where you should be. This is where you should not be, right?
Right.
And so I love that, we can inspire little girls to
Yeah,
to
no,
dream big, to
absolutely.
dream big. Yeah.
Yeah.
So,
I don't, do you remember the movie? I think it was Don't Tell Mom the Babysitter's Dead. There
I
was,
don't remember that one.
it's similar to the woman in the movie is similar to the
Uh-huh.
woman that's in The Devil Wears Prada.
Uh-huh.
And then
Oh
she
yeah.
goes, I'm on top of it, Rose. Rose was like the mean boss where everyone, when
Hmm.
she walked in, everyone was sort of like, Rose is here. So
Yeah.
for me, I loved everything about that character. I don't
Uh-huh.
know why, but that also signified this. It just meant something to me. It was very
Uh-huh.
impactful to see a woman in power where she walks into
Hmm.
the office and everyone straightens up.
Yeah.
So, and I knew she
Yeah.
wore heels and a suit, but I figured
Uh-huh.
when she was walking outside, she had on sneakers. So,
That's awesome. Yeah, because I know that the depiction was very mean in the movie, but
right,
yet, yeah, the underlying, I guess, thought of having a woman in such a powerful position where everyone garners or she garners that respect
right.
immediately is pretty powerful. But so speaking of that, like, speaking of leadership and what that means, like, what does leadership mean to you?
Leadership. So, I
Mm-hmm.
mean, we all know what the word, I guess, in the Webster
Mm-hmm.
Dictionary is. To me, and this is why also I stated that, women, specifically moms, leadership, we all do it in some capacity. How
Mm-hmm.
you own it is really going to be the difference.
Yeah.
As a kid, I was captain of track teams,
Yeah.
president in PA school. So there were leadership positions that I
Mm-hmm.
naturally gravitated towards.
Yeah.
So to me, I feel like in leadership and just in roles where people are looking to you for assistance, for direction, for motivation. Like, I feel like that's what leadership is, like being the person that's, everyone's looking to, like, hey, so what are we going to do?
Mm-hmm.
Whether it's called leader, whether it's called mom, whether it's called captain, whether it's
Mm-hmm.
manager, people are looking to you to help. And I feel like, of course, a lot of times there's like a hierarchy, designated and who you listen to. I feel like just like a mom, as the mom leader of the house, you're not just spitting out orders. This isn't the Navy or the Army. You really just want to be able to pull out and help nurture all of the great things and the people that are looking to you to help, you know? So to me, I get the term leadership, but it's also just helping those around me, you know, find their powers, find their, you know, strengths, you know, work on their weaknesses. Like it's really just being transparently available and open to help everyone around you when there's a question, when there's a need, just like being a mom.
Yeah.
So leadership and motherhood, synonymous.
Yeah. Yeah. I mean, exactly. Leadership to me also feel, as you're saying, is we have an influence in different groups that we're part of, right?
Right.
And we can use that influence to better the environments that we're a part of, or just lackadaisically kind of just go with the flow. And so, what are we using that influence that we do have, whether it be the motherhood, the families, the communities that we're serving in, and the workplaces, right?
Right.
And I also love how that you were saying that leadership is bringing out the best and the strengths of others, and helping them also blossom where they are as well, right?
Right.
Yeah.
I feel like a lot of in positions of leadership and positions of power or authority, I think it's really important to keep a pretty good gauge on yourself. I think that sometimes when you're in this position of influence and power, you can create positive things or you can
Mhm.
create more chaos. And I feel like sometimes in leadership, if you're not able to put a pulse on yourself and check yourself and say, okay, what am I doing to aid in this problem? How could I help? Sometimes you're like, I feel like if you're creating more chaos, some people sometimes feel as though it's making their job more relevant. Like, look how messy the house is. Look how crazy the kids are behaving today. Like, it's just my job is so hard. And it's like, how did you wake up? What did you walk in and say and do? And the same thing goes for the workplace, like for the Devil Wears Prada, where everyone's just on pins and needles and edge when she walks in. That's absolutely not the effect that I want to have on anyone that I work
Yeah.
with. But in that same breath, if that's the energy that you bring, you are not bringing out the best in the people that are working with you and under you. If, you know, that's the feel that you give when you walk into a room, that's not the feel that I want to give. I want people to feel creative. I want people to
Mhm.
feel like she really helps bring out the best in me. So for me,
Yeah.
that's, you know, optimal and prime leadership. So yeah.
Yeah, for sure. I think that's what's most important, in having someone who is leading, is what are you doing to really be that person who's kind of bringing everyone along in that same mission, right? If you can't have them feel good about what they're doing and want to improve whatever the mission is, then how are you really going to be effective, right?
Right.
Yeah. Just like in family, it's you have to have one goal, one mission. Everyone has to join on board.
Yeah. You
Um,
got to get the buy-in, even from the
yeah,
toddler. You've got to get
yeah,
the buy-in.
right,
Yeah.
right, exactly. And so, I mean, speaking of leadership, and as you know, we're both physician assistant, physician associates, PAs. How do we as PAs advocate for leadership, and what do these roles look like that you have seen? And kind of comparing, like, over the years, I feel like we have gotten a little better um, in getting these roles, but like from what you've seen, how has that been?
I feel like there's definitely a lot of room to grow and where they're
Mhm.
allowing PAs to take up space in operations and administration and leadership. Um, I feel like, you know, there's a lot of institutions now that, you know, how every floor has a nurse manager, you know,
Yeah.
there's roles for nursing across the board, from bedside to administrators to VPs of hospitals. I feel as though not enough PAs want to, desire, or give a lot of pushback for wanting those roles. When you look and it says, looking for an NP to be the director of acute care, why not a PA? And the PAs that do not apply, the PAs that do not, inquire about why not a PA, then it's not a PA. I think that there's a lot of programs now that exist. They're called clinical program managers within hospitals, where that role is open to APPs. I think that it's going to have to start with a mindset change in us. Like, we have to provide the pushback. We have to say, I can do that too. We have to show that we can do it too. The program that I graduated from with Rocky Mountain University, their program is geared towards healthcare administration and leadership. And they're really encouraging us to create these roles, to raise our hand and say, why not us? But without actually looking into the roles and looking into what they're looking for, and being able to say, I can do that. That's me. If you don't confidently say I could do it, you're not going to get the job. You're not going to do it. And that does nothing for our career. It does nothing for our profession. So I feel like a lot more of us need to step up confidently. I saw and met a PA through the NISPA, New York Society of Physician Assistants. And she told me, I'm in bioinformatics. I work in tech in the hospital. And it just happens to be like, if you're in a room, when Epic came into NYU, we had super users that were there. And then you became a champion or a super user if you were really good at it. That right there would have been a prime opportunity for me to even merge into that realm of bioinformatics and electronic medical record systems. Like, these are ways that we insert ourselves, because they see, oh, wait, you're strong at that. And it's like, you should own it, and you should full speed ahead if that's what you want to do. So I think it takes a lot of introspective, discussions with yourself on what it is that you want to do, how you want to show up, and how you're going to show them that you can do the job as well. Like, I can't tell you, you've got to want it, feel it, and then go for it.
And creativity to think of those innovative ways to kind of be in more of a leadership role that's not necessarily traditional, right? Like you're saying about the bioinformatics, or different ways that they could potentially increase that advocacy for themselves. Yeah, because I was reading that, it's and obviously we all know it's really, as you said, hard to get more APPs in these leadership roles, because I think we are all kind of used to not being in these roles, and we're just really not pushing for these types of positions, or even pushing for ourselves sometimes. And that's like even advocating for ourselves. Why do you think that we aren't really advocating much for ourselves? Because I know they're, compared to other APPs, nurse practitioners in general, like, they have learned the art of advocating for themselves and lobbying for their profession. But I know there are a lot of grassroots initiatives that, even here in Oklahoma, a lot of APPs PAs are stepping up and trying to advocate for the PA profession within states. But I think we've kind of like become, in general, kind of like just okay with where we are. But why aren't we really advocating for ourselves more?
I think we're just comfortable. We're comfortable. I think we've come a long way with people even knowing who we are and what we do. And I feel like at one point, the biggest fight was explaining that we're not medical assistants, we're physician assistants, then explaining that we're not actually assisting, and then, going from a physician assistant to physician associate. So I don't think that it's a lack of wanting more. I think that, we're sort of baby stepping it. We haven't been around as long as nursing has. We don't have the
Mhm.
lobbying and the advocacy yet. We are
Yeah.
working on it. PAs for
Mhm.
Women Empowerment. I'm the vice president of that organization, where
Mhm.
you're with a group of like-minded women who want to see the profession move forward. And
Yeah.
it's organizations like that, it's groups like that. I don't expect everyone to want to pick up this torch and run with it. Like, we
Mhm.
all have so much on our plate. If you're
Yeah.
comfortable, if you love
Mhm.
what you do, this
Mhm.
isn't to say any shame on you for
Yeah.
not pushing for that APP leadership role. It's like, no,
Yeah.
it's okay. It's
Yeah.
very much so okay. But
Yeah.
when you can surround yourself with a group of PAs who all want to see the
Mhm.
profession move forward, that's what you do.
Mhm.
You drive forward
Yeah.
together, you drive for the change, and
Mhm.
you do the things that you want to see happen. Like, it's not going to happen unless we do the work. So if you
Yeah.
want to do the work, strap up, let's go. If not,
Yeah.
that's okay too. That is
Yeah.
a-okay too.
Yeah, and I think as you said, there has been like these huge shifts that have been positive for the PA profession. Because number one was making sure we aren't just medical assistants, and
Right.
so there has been like real great strides made in helping kind of other patients and populations understand what we do and how a PA works within the team, within the clinics, within the hospitals. And I think, yeah, that's what exactly the right thing is. What you're saying is that we haven't been around for a long time. And so we've had to kind of start from scratch in just identifying who we are within the medical team and letting patients be aware of that and how we can help them. And now patients are more aware because they say, oh, yeah, I see my PA in my clinic more often than my
Yes.
doctor, and, they're more familiar with that in the term. And I think that was step one. Now, step
Right.
two is seeing what else we can do. Because I know I feel like every PA I know, they want to enhance patient care. They want to improve the quality of care and be that team member who, helps improve the workflows, improve the way patient care is done within their scope of practice. Um, and how do you feel like that, PAs enhance patient care? Um, Given that we have to establish that first in order for us to help push for, um, I guess, advocate for ourselves in a way more, right?
Yeah. Yeah, no, I mean, I feel like it's and it may look different for your state, but for New
Mm-hmm.
York, for the most part, PAs, we're everywhere.
Mm-hmm.
You could throw a penny and hit a PA school.
Uh-huh.
We've got PA schools everywhere. We've got kids who openly are like, I want to be a PA when I grow up, because they've been seeing a PA since, they were in their pediatric practice. So
Uh-huh.
the word is out there, what we can do, our ability to
Mm-hmm.
provide care, to fill the gaps in
Mm-hmm.
underserved communities and places where the patient numbers outweigh the providers. Like, we're not here to necessarily, take claim to any,
Yeah.
physician. But I
Mm-hmm.
feel like working together, we've pretty
Mm-hmm.
much shown and proved that we definitely are here and capable of filling that gap and providing excellent care. A lot of the feedback all of the time, and like I said, this is no shade to physicians, but
Yeah.
if a common statement of all non-medical people who go to see PAs always say, I spend more time with my PA. They let me ask more questions, they explain more. And part of that for me is I have to gain your trust without
Mm-hmm.
walking in and saying, my name is, Venee Cunningham, your medical doctor. If I go in and say, hey, I'm PA Venee, I'm the physician assistant, you're sort of like, so when's the doctor coming in? I have to sit with you. I have to show you that I'm knowledgeable. I have to gain your trust.
Mm-hmm.
So, with that, I feel like we've been able to make leaps and bounds because that's just been an unspoken thing that we do. That's why patients feel like I talk more with my PA. I've spent more time with my PA. It's because we had to spend the time to gain your trust, to show you that we
Mm-hmm.
are fully capable and able to provide this care for you with the, supervision of whatever physician we're working with. Trust me, I got you. I know what I'm doing. So
Yeah.
that's been that's been our thing.
Yeah, that's very true. Yeah. Having to, it's not explaining what we do, but explaining what, when we see the patients, explaining more in detail what we are understanding, what's happening and going on, and just that conversation. Yeah, that building of trust has gone a long way.
Yeah.
And I hope that we can, yeah, make sure that we continue to do that, especially with our physician colleagues and team members, because I think that is also something so important. Because as a PA, we are part of the team, and we have close working relationships with the physicians that we work with, and that trust with our physician counterparts are vital to that patient care aspect, right?
Right.
Um, and also for the physician to want to advocate for us. I know there's several stories of PAs who, because of their trust that they've developed with their physicians, because the physicians can trust that PA, I know my PA is going to take great care of all the patients and will do an excellent job. And that's why I'm definitely, you should take, I think it was your story, you were saying someone recommended you for a leadership role, or maybe it wasn't. I can't remember
No,
now. Yes.
possibly, but I've run a primary care office for a
Mm-hmm.
physician that I never met. It was literally just the whole entire family has their own medical practice, a
Uh-huh.
mom and two children. When they take their family trip, when none of the Dr. Hotties can go in, I was someone that since 2013 I've been called to go in and fill in for the week or fill in for a day here and there whenever I could at their
Uh-huh.
practice, based off of word of mouth of,
Mm-hmm.
oh, you need a PA to fill in while you're gone? Try Venee. She's great. Your patients will love her. And literally the very first week that I filled in, she
Uh-huh.
has yet to meet me to this day. And she's just like, Venee, are you available? And that's from patients telling her, well, you were gone. You had this PA here that was amazing. So she's like, okay, then we know who we're calling.
Oh, wow,
So,
that's even
yeah.
better.
And that literally came from just word of mouth. I think she
Mm-hmm.
mentioned my name, or not my name. She mentioned that she needed help. And
Mm-hmm.
someone said, oh, I know a PA that may be able to go.
Mm-hmm.
They reached out to me. I went, and I have not stopped going since.
Yeah, yeah. And
Yeah.
that's to the point that I was mentioning, is that, when we have then built those trusts with our colleagues
Right.
and relationships, that then they know, hey, this is what a PA can do. And I can vouch that, they are trustworthy, that they do excellent patient care. And that's another way of advocating for ourselves, right? Just
Correct.
through our work and proving how we are important to the team. Um, and I guess that goes into our next question in a way, is like, why is team-based healthcare so important? And actually, I think there, definitely has been a shift over the years to team-based healthcare, from just, single providers and, the old way of doing things, just the primary care doctor goes to the hospitals, to the clinics, to the skills, to the everywhere, just him himself, but now it's all team based, or trending more that way, right?
Yeah, it's literally a lot of things are changing. We're going
Mm-hmm.
from they're going to start in primary care, at least in New York. We're going from fee for service to value based. Where are
Mm-hmm.
you meeting all of the metrics? Are your patients that have hypertension,
Mm-hmm.
on their medications, having their medications filled every 3 months? Are they getting their mammograms? Are they getting colonoscopies? And the payment is going to be based on the value
Mm-hmm.
that you're bringing the patients by treating them as a whole,
Yeah.
covering these chronic conditions on a
Mm-hmm.
very on maintaining them the way you
Mm-hmm.
should. It's not just when they come in and you load up on 6 months of medication. It's like, how's your monitoring? How are you
Yeah.
meeting all of the metrics that this 50-year-old male should have done at his age? So
Yeah.
once payments switch to that, I feel like
Mm-hmm.
there's going to be another switch and I
Mm-hmm.
guess a shift in the
Mm-hmm.
in medicine, because you've got to kind of treat the patient as a whole, and that's typically going to take a team. So
Yeah. I think they had already been doing some of those switches in hospitals, though,
yeah,
with value-based payments and things like that.
right, versus the fee for service, correct.
Mhm. And so, but yeah, there's a lot of shifts in medicine, still a lot more that we can improve on as a whole, like medicine. It's such a difficult, you know, difficult career, actually. Once you're in it, there's so many things that crop up that are difficult to kind of actually just focus only on patient care, as we've, find out in working. I was talking to someone else, who was talking about PA, choosing between PA versus medicine as a physician. And, sometimes, they say, well, PAs take a little longer to speak with us or, spend more time with patients, but yet we do still have to see the same number of patients or be, productive and show that productivity and number of patients per day. There are certain things that we still do have to do that still make it a little harder to actually get those, that practice in medicine. Um, because of different payments and insurance and all those things that come. But I know they're trying to make it better through these different payment plans and hopefully help us focus more on looking at patients as a whole and preventative versus uh, proactive treatment. But
Yeah. I
yeah.
think that part of the issue that you're discussing, and that a lot of insurance and all of the
Mm-hmm.
policies and the back ends that be, a lot of these exist because we are not in those rooms with those conversations on
Mm-hmm.
what we're seeing. Like, decisions are being made by people who have business degrees and have never
Mm-hmm.
touched a patient in their life. So there has to be, if you see that there's an issue and there's something that you can provide solution wise, just by being in the actual, in the pit of it, you're there, you're on the front line doing the work. When you get behind the scenes and you start saying what'll work and what wouldn't work, or what should be done and what could be done to benefit both patients and benefit both clinicians, these are valuable inputs and experiences that we could provide on the back end of things. It's just, you almost have to push that door in to get in there.
Mm-hmm.
So we have so many, I guess, gripes with, oh, we see 120 patients a day, and this,
Mm-hmm.
we're doing this really hard work, and it's like, these are the problems. Yes. Are you ready to talk solutions? Are you ready to make your way to that back end meeting and say, this is what's happening on the front line. This is what should be done, or this is what I think should be done. If we're not doing that, then I can't say the change is anywhere near. It'll
Yeah.
happen, but it's only going to happen when you get those that are ready to, say, hold on, no, it's not going to stop here. We're not going to have this water jug conversation and it ends
Yeah.
here.
Mm-hmm.
Someone's got to take it to the higher up. Someone's got to take it to corporate and say, this needs to change. And then you need to make sure you're always in that meeting. You're always there to give that input, so it doesn't have to be an MBA. An
Yeah.
MPAC is perfectly fine with
Mm-hmm.
several years of experience. You know a good amount of things that would provide so much value. So
Yeah.
yeah.
And in your experience, have you seen, like, when you have seen something like that, could be changed. What have you done? Like, I think you had mentioned how you have changed things based on what you had, like just speaking exactly what we're talking about is if we see something, what has been done? And in your experience, how has that been effective? And have you seen that result before?
Yes and no. The position that I am in now, I'm having a hard time with the way patients are billed. And this is something that's completely out of my control. It's completely out of my immediate manager's control. And I fully understand that even going higher up, the way that I'm seeing this as an issue means that the bottom line, which is always money in medicine, there's going to be money lost if I did it my way. And this is the difference between an MBA and a PAC. I'm here like, this is wrong. My patient is here trying to decide whether or not they go grocery shopping or they pay their telehealth visit deductible. And that's not right. There's got to be a compromise somewhere because it's not right. I know that health insurance and policies that be are beyond my control, but as long as I'm continuously going, it's not right. As long as every single time you see that you collect that telehealth visit of $100 and the CEO can hear my voice go, but that's not right. My patient had to decide whether or not she was grocery shopping or hearing her results from me. So I've decided, in this space, I know this it's nothing that I can change, and I'm not going to lose sleep over what I can't change. But I do have a voice. My voice is powerful, and I won't just sit and say, well, they said that's just how it goes. I'm going to go, it's not right. Well, what do you suggest we do? I don't have the ability to tell you what to do. I can tell you it's not right. We can discuss what the options are if you're willing to do it. But if we're just discussing it just for me to tell you that the policies and the insurance won't allow you, why have the discussion? So this is going to be a decision that comes from the top because money would be lost, but that's going to be a decision that's beyond my control. But I will tell you it's not right.
I think that's the whole difficulty, right? I mean, is that we want to provide patient care and then we come up against these things that are difficult. Yes, we want to try to kick down those doors, break down those glass ceilings, so to speak. But who's listening, right? And how are we? I think, it's going to be a lot of policy change that's going to have to work in regards to that. Because I know, I think I can't remember exactly what the numbers are, but the number of people in medical debt in America is staggering.
Yeah, absolutely.
And I don't know. Unfortunately, privatization is what most people want, but it's not really what's really helping a lot of people, though. But it's interesting because it's exactly, you're saying, how do we knock down those doors? How do we, speak to these issues? And, even in your current position, you're finding that roadblock. And I think a lot of practices kind of might be like that. But, how do we?
It's a locums assignment for me now. So this locums assignment, it's nothing that I have planted my feet in, but it's like the New York City subway says, you see something, you say something. I feel like the older I get and the more sure of myself and what I can provide, what I know, what I don't know, silence just isn't an option. Like, you would have had to catch me in my 20s, early 30s if I was going to sit here and zip it and throw it away. Now I'm like, you say, hey, good morning, Venee, how are you? Be ready. I'm telling you exactly how I am, exactly how I feel, and what happened the other day that I did not agree with. If you don't want to know, say good morning and keep going. If you say, how are you? How are things? You've opened the door for me to tell you. And I think that a lot of people don't realize that the power in their voice, the power in saying what you feel, what the problems are, it doesn't make sense to stay silent. Nothing changes if you don't say anything. And silent support is not support. So if
No.
you feel
Yeah.
as though something's good or something's working great, say it. Say it to someone in leadership and operations and management, because that's the only way these things stay. But, silence won't ever help any
Yeah.
of us. So,
Yeah. And I think there's a quote by, I can't remember who, but it's like, when we needed you the most, we remember your silence, because that, silence speaks volumes, because you're not doing anything to help anyone, right? Um, so, moving on to a little bit different topic, like, I was looking up some statistics and saw some AAP report which had reported like male PAs made up 36.5% of formal leadership categories, and almost 2 out of every 10 male respondents in the 2022 AAPA salary survey were in a formal leadership role, but only 10.9% of female PAs in that same report had a formal leadership position. And the majority of PAs are mostly women. And so it's interesting how even with the majority of women being PAs being women, yet the majority of leadership roles for PAs are by the males who are PAs.
right.
And so that's kind of interesting, and kind of goes into how, you're on the PA Women's Empowerment as vice president. And I know you guys have been working on advocating for women empowerment as a whole in general, but what are you doing for women's empowerment, and how are you kind of like taking those actionable steps towards that, and in for PAs as well?
Well, it's not specifically like the numbers that you're speaking to regarding women in leadership positions for PA, specifically profession. That is a statistic that stands true across the board. Like if you look at teachers, if you look at police
Yeah.
officers, if you look at, I'm sure even if you look at nurses, it is
Yeah.
probably across the board just the thing. So
Yeah.
it's really, I wouldn't say that, it's not new, it's not okay, but the purpose of PAs for Women Empowerment, we're not necessarily trying to push people into leadership positions.
Yeah.
It's just,
Yeah.
advocating for the profession as a whole, advocating for us to be seen and for, you know, policies to be put in place to help our practicing guidelines. Like, there's some states like in New York, I think you can have like 8 PAs to one physician, or potentially 6 or 4. I'm not 100% sure because the number changed for the pandemic. And, we've got a governor who we meet with, well, NISPA, we're pretty much in her ear about policies that we want to change and things. It's just kind of making sure we're present, whether it's your state society, whether it's the AAPA, PAs for Women Empowerment. We have to, and we're only stronger together. Like we have to show up, we have to be loud, we have to make our demands known. Like it's not necessarily, hey, take that position for leadership. It's state what your issues are, state what you need, state what the changes have to be. You do not have to be in a position of power to make requests and to make it known to the people that are in power what changes need to come about. So we're not, like I said, it's not necessarily a thing of we need more women in leadership. It's we need more women to actually embrace the power that we have to show up and to do the job that, they said you couldn't do per se, So
Mm-hmm.
these are the things that we have to do more so than, take these other roles because we've got a lot of roles. And
Yeah.
for me, at one point in my life, I was okay with being an urgent care PA, an ER PA, doing my 12
Mm-hmm.
hours, making my hefty salary, living my life, living my best life.
Mm-hmm.
Now it's like, I don't like that. But for me, I have to go way past, I don't like that. I don't
Mm-hmm.
like that. Now, what am I going to do about that? So I, my vision, my mission is not everyone's, it's mine. So this is
Mm-hmm.
where I'm at. I just,
Mm-hmm.
advocate and tell women, temperature check, see where you're at, see what you want to do, see if you're happy. And if you're not, ask yourself, what is it that's going to make me happy? What is it that I want to do? And being a PA is glorious. We can make 100 different shifts in our career and
Mm-hmm.
we'll be A-okay. And
Yeah.
so, yeah, it's just really to answer the long-winded version of that question. That's the answer. But ultimately, I think that this is a fight across multiple professions that is just going to take us continuously kicking down doors or building our own. That's it.
Mm-hmm. Yeah. I love that though. Because yeah, not everyone has to be in a leadership position,
Right?
but we do need to speak out when it's needed, to alert what needs to be changed, right?
Yeah.
Yeah. And how can we encourage and inspire PAs today? Any words of encouragement for PAs, to inspire them to continue in their work and leadership, or
Give up
motherhood?
now. Give up while you're ahead. No, no, no. Give up before it gets worse. No. Honestly, you're not alone. Like I feel like part of these organizations like PAs for Women Empowerment, like PA
Mhm.
Moms, I remember when if my phone was able to tell me how often I was on the PA Moms page, I remember where I needed that for my sanity. Like
Uh-huh.
to know that this random rash on my child's scalp isn't, something that no one's ever seen before. You know, how many urgent care visits were saved by people telling me these, derm conditions that I had never heard of before. But there's a network of 20,000 moms who, just like you, are a clinician. But when it comes down to our kids, we're like, ah. So I would say for anyone, for in any profession, you surround yourself with people going through the same things that you're going through in any capacity. For PA moms, we're all PAs, we're all moms. So
Yeah.
that similarity brings us so close together because
Mhm.
there's so much solidarity found in the craziest things when you're like, I must be alone going through this. I must be the only one feeling this way. And it's like, nope, out of 20,000, there's a good 15,000 that feel the same exact way you do. And
Yeah.
that alone, the way you just feeling less alone is so, it lifts half of the weight off of you because you're there thinking you're carrying it by yourself, and then you just pass about 1,000 bags onto another few other moms like, oh, we've all got these
Mhm.
bags, okay, what are you doing with them? And it's
Yeah.
just it's honestly, you have to lean into and towards the people who get you, who understand, who are doing the work.
Mhm.
That's the only way to survive. You're not going to be able to do it alone. So get mentors, get people who can relate. That way you feel a lot less crazy.
Yeah. That's so true. And yeah, I know I definitely love that PA moms community. It's been amazing to realize that, yeah, there has been many others who have experienced similar situations, gone through
Yeah.
the same things, and overcome and made it through.
I'm not crazy. I'm not alone. Okay. This
Yeah.
helps.
And so, well, thank you so much, Venee. I
You're
really enjoyed this
welcome.
conversation, and I know we have a lot of work to do.
We do.
and
That we do.
and so hopefully, like you, people like you will step up and continue the work and continue inspiring others and encouraging others and making those changes that we have already benefited from others advocating for our professions, right?
Right. Absolutely.
So thank you again. Thank you all
Thank
so
you.
much for listening. I hope that you have learned how to spark hope and know that when you speak up, you're not speaking up only for yourself, but for all those around you who are going before you and who are going to come after you. Thank you so much for listening.
Thank you. Thank you.
Thank you, Venee.
You're welcome.
Have a great week.
You too. Enjoy.
Thank you for joining us on this episode of Medicine, Motherhood, Missions. We hope you found inspiration, insight, and a sense of connection in the stories we shared today. If you've enjoyed today's episode, be sure to subscribe and leave us a review. Your feedback helps us reach more listeners like you. Follow us on Instagram for updates, free downloads, and to join a community of like-minded individuals passionate about making a difference through medicine, motherhood, and mission work. Remember, you're not alone in this journey. Until next time, keep sparking hope, keep healing, keep nurturing, and keep making a difference. This is Johanna signing off from Medicine, Motherhood, Missions. The medical opinions expressed on this podcast are for the informational purposes only and should not be considered as medical advice. Always consult a licensed healthcare provider for personal medical questions or concerns. The views expressed by guests are their own and do not necessarily reflect those of the podcast host.